Hello, my name is Sarah Hancock, and I live with toxic encephalopathy, which means that my brain, for whatever reason, is very sensitive to blood-borne biotoxins, whether they're candida byproducts or mold spores or infections, bacterial infections. And so I have a host of symptoms ranging from symptoms of anxiety, depression. When it was really bad before I was properly diagnosed, I was misdiagnosed with schizoaffective disorder, bipolar type with catatonia, and PTSD, and then like just a host of psychiatric symptoms. Then I started experiencing motor problems, and because of my history of psychiatric illness, they decided that I had a conversion disorder. But gratefully, I was able to find a doctor who understood what toxic encephalopathy looks like and understood how to treat it. I'll be forever grateful for Dr. Humiston at the Center for Health and Wellbeing. And anyway, I was doing great. He was treating me for mold toxicity and for candida, and my brain is very vulnerable to biotoxins for whatever reason. And so this past 2 months I was having just progressively deteriorating, and we couldn't really figure out why. I was being very diligent with the diet, very diligent with the antifungal protocol, and then I started experiencing symptoms of a UTI. And so we did a culture. We had to be very careful. He didn't want to prematurely prescribe any antibiotics because I do have a history with candidiasis. And so when we got the culture back, because I was experiencing symptoms of a UTI, he put me on one antibiotic. And then after I was on the antibiotic for about 36 hours, I was just getting progressively worse, and I was having problems with back pain. And so he suspected that my UTI had spread to my kidneys, and it was a staph infection. So when we got the culture back, he immediately changed the antibiotic. And last night I went to bed completely dystonic with difficulty speaking, difficulty walking, difficulty talking, and difficulty feeding myself, holding things. And this morning I have complete finger dexterity, complete ability to walk, and I'm no longer cognitively fogged or having difficulties with anything. So many doctors call what I have a conversion disorder, but it's really a question of diagnostics. They're just not asking the right questions. And so conversion disorders frequently occur because the doctor isn't familiar with the symptoms that you're experiencing. And so because of that, they're willing to just put a label on it and not continue to ask questions. And I'm grateful that I found a doctor who was willing to ask the weird questions, because it's changed my life and improved my quality of life so much. Anyway, so it's just the update for Sarah and living with toxic encephalopathy, and I am so happy to be walking normal again. Talk to you soon. Bye.